The COVID crisis is bringing many challenges to companies. What has been starting as a health crisis is now also turning into an economic one. And one player that for sure is under stress is the healthcare provider, so the hospitals. In their quadruple aim, they try to improve the health outcomes, they need to control for cost, safeguard patient experience, but also they need to take care about the well-being of the workforce. And nowadays we see many actions that try to realize that quadruple aim. And many of those actions are centered around the concept of flexibility, so the ability to adapt. In the remainder of this video, I would like to offer a short categorization of different flexibility measures. And this is quite a generic framework. I will differentiate between operational flexibility and flexibility on the level of human resources. First, operational flexibility. And here I do follow the categorization of Slack and Lewis. There is delivery flexibility, the ability to change the location and the timing of services. Think about the flattening the curve. What is the idea? The idea is to have a better spread of the demand of healthcare, so that we can lower the peak usage of our scarce resources. This makes sense, but of course we also need to be able to sustain this longer period of care. Second, there is volume flexibility, the ability to deal with the variability in demand for healthcare. And indeed, we see that hospitals are transferring regular wards into COVID wards, or they are ramping up their capacity of intensive care services. Third, there is mixed flexibility, the ability to offer different services and products. And hospitals typically have a lot of mixed flexibility. They have the elective program, the planned program, but also the non-elective program, where we see already a downscaling substantially of the elective program so that we can free up resources for the non-elective program, in other words also to support the volume flexibility. And fourth, there is something like product or service flexibility. This is the capability to offer new products or services. Think about the many companies, although it's not within their core setting, that all of a sudden start producing masks or protective wear that then can be offered to the healthcare institutions. Now, on the other side, the HRM side of flexibility, there are two kinds of flexibility I would like to pinpoint. And this, of course, without being exhaustive. First, there is functional flexibility. Functional flexibility, so the ability to work across different specialties. And the more functional flexibility there is, the easier it is to switch from tasks. Now, within the hospitals, we also see a lot of training ongoing for the time being to increase that functional flexibility. Second, there is the flexibility of renumeration. To what extent will the legal framework allow for a longer period of overutilization of some resources, or potentially also the severe underutilization of some resources? And remuneration does not need to be limited to monetary terms. It could also be a kind of appreciation. I see hospitals that are building an in-house grocery store so that the personnel does not need to bother about the hoarding that is ongoing and finding food after their shift. Or hospitals who offer dedicated childcare solutions so that the healthcare workforce can really focus on the provision of healthcare. Now, let's bring the two together. On the one hand, there is workload, and workload can be impacted by operational flexibility. On the other hand, there is the individual and the individual resilience that can be impacted by the HRM flexibility. Workload together with individual resilience, together they will make the work pressure something subjective. And it is this work pressure that eventually will translate into productivity, absenteeism, burnout, and so forth. So more than ever, I believe flexibility will be needed to deal with that mental challenge that is waiting for us. Not only today, during the COVID period, but for sure also in the many months afterwards.